Good morning, everyone. Good morning. All right, let's try better. Good morning, everyone. Good morning. How wonderful to have a primary care-centered event, hey? By the way, it's not just primary care colleagues around the room, which is brilliant because as a system, any health system, we need colleagues from all parts of the system to be in the same room. And I'm proud to say that today we have commissioners, we have policymakers, we have providers, primary care, of course, and we also have some secondary care colleagues here too. We promise we won't bite you guys, right? Secondary care. Just kidding. So look, guys, it's a real privilege to be here and to host you all, and what a fantastic venue, right? When we first found it, I can't take credit. My daughter, Claudia, is running away, and she apologizes for all the emails she sends you guys. But when we saw this place, it was under full construction. But we could see the vision of what it could become. And thank goodness, there's screens and there's seats and there's room, so we're here today. But we thought this was a very fitting venue for our event because we wanted to be futuristic. We wanted to then match it with an ambience and the place for us to think broader, bigger together. And it's not a place that is too crowded, isn't it? With everybody all packed in and stuff. And I also want to obviously thank you guys for being here, right? Because many of you braved the rain to be here. And there's others trapped or slightly delayed with trains, but we'll have the room fill up further. So let me get moving along. I just assume you guys know me, so that's too arrogant of me. So I'm Vincent. I'll be the host and chair for today. Any problems, ask someone else. Just kidding. No, just kidding. I'm here, and I'm here not just by myself. I have my whole team from Modality Partners. You won't see how many senior GPs packing goodies bags in the morning at 7. So it's a real sort of family approach to our event. That's my LinkedIn, by the way, if you guys wanted to connect up. So just bear with me because I didn't want to assume everyone knows who we are. So today we're here as Pathfinder. So Pathfinder is our social enterprise. So our mission is to promote universal health around the world. And that's something that has led us to different parts of the world, which I'll explain in a second. But at the core of Pathfinder, the founders are Modality Partners. And Modality Partners, we are NHS grassroots general practitioners. Nothing more, nothing less. Just GPs grafting day in, night out, right? As many of you guys do as well. And not just us in primary care, but in the whole system. We started with 2 practices over 15 years ago now. And we currently have 500,000 patients for our list. By the way, we're still partnership. Crazy, 140 GP partners working together, right, as harmoniously as we can, okay? We cut across 55 sites. I think I can say we're a super neighborhood, actually, Claire. I think we cut across 19 neighborhoods. But we also provide outpatient services because we believe care should be delivered closer to home. So we have our GPs with specialist interests. And we actually have reached to more than 20 million citizens now with our 18 specialties that we team up with secondary care to deliver. And as I mentioned, we are trying to make a difference. I do think we make a difference. The whole health service does every day. But we are trying to promote knowledge sharing. And hence, that has brought us to a global academy knowledge leadership, thought leadership series like the ones we are here today. Okay, let me click. So a little bit more about the Pathfinder mission. As I mentioned, we are promoting universal health globally. And we've been busy, as you can see, with us growing our footprint and just improving and learning to be at scale. But our global reach has actually grown quite dramatically in terms of the different countries and collaborators that we've been able to work with around the world. And by the way, this isn't a pushing thing, right? We didn't really know what we have, and this is something you'll find, right, in the NHS overall, not just primary care. We have a lot, guys, and we have a lot to be proud of. We have a lot to do, too. but we should not forget what we have and we should harness that. So we've been pulled into different conversations globally, people asking, how does the NHS work? We admire the NHS. How does primary care in NHS work? How can we bring some of those standards and infrastructure into their own countries? So I don't want you guys to think that we have clinics in every part of the world. We don't. We have no aspiration to pretend to be in somebody's home country, to be something else. We have to be very respectful. But we found that a common language is to learn, to share, and to learn with one another. And so I'm very proud to say there's a whole bunch of folks who's online as well. I think there's folks from the UK, obviously, but there's also lots of folks from overseas who are on the call, especially South Africans, actually. I should call them. I'm going to become an honorary South African soon. Well, we have a great collaboration with the Alliance of Independent Practitioners there, and they run their own events, and there are many colleagues joining us on the call today. Now, we won't be here today if we didn't have our sponsors. So again, if I could get everyone to have a quick clap, applause for the sponsors. By the way, this is a highly curated group of folks. We did even turn money away from people because we wanted to maintain the ethos of the room and making sure it wasn't just about money because we're a social enterprise. But you'll see it's a brilliant mix of innovators. I've got my partners in South Africa, for example. Every organization here has a history of trying to make a difference in their own way, whether they're starting out or been around a little while. So you see we have a nice blend of partners who's supporting us today. So, by the way, it is a long day, right, that we're going to have together. So can anyone guess what this line, this graph is saying, right? You're very smart people in the room. So we got a function of energy with the time of the day. So this is the bit that I'm supposed to lift you guys up, right? This is the upswing, okay? I hope it's working. I need to see more evidence to be convinced, like, yes, I'll get that soon, okay? Yes! Of course, Gune, yeah. We'll do that when your session's up too. Thank you, Gune. So guys, this is a typical event. As you stroll through the day, you're gonna go, and you're gonna, okay? It's very normal. However, this is not what we're gonna do today. Okay, anyone complaining about flowers, spring, summer? Yeah, we got the, yeah, I know, I thought we had sunshine, but we got rain, but it's okay, right? We have sunshine indoors, right, with flowers and stuff. So our job, not just mine, I know I'm on stage and having to talk a lot and you put up with my very bad sense of humor sometimes. I'm called the chief cringe officer at home, by the way. But we are the orange, right? Everyone's got the beautiful lanyard, orange. We're going to set the tone right up there. And you guys know the stellar lineup of people we have to speak. And by the way, I will say this now, not to embarrass them. They're not just super thought leaders in the sector, right? They are great individuals, right, who are trying to make their own mark and the difference to communities. So we set the tone. Of course, naturally, there'll be some dip through the panels, no pressure panel chairs. Right? Make sure you keep that up. But we shall have artificial injection of sugar and other goodies. I shouldn't say sugar, where's the lifestyle? Sorry, Vipin. We have very healthy snacks. Even the lunch menu today is personally curated by my GP partner who is expert in lifestyles. Any complaints, he's the guy there. But look, we're going to maintain energy way above. And we're going to have some fun, right throughout the day. And the main thing is we're going to finish on a high, okay? We're going to go, pace, then finish. And you know why you finish on a high? Because you're going to get the action. Today is about not just theory, but real things people are doing. Get inspired by them and take something home. Take something back that you do something with. That's why you go back on a high. Does that make sense? So this is no prescription neither. It's a free drug, okay? So, but play in. The more you know the saying, you get what you put in. So hang with us. right? Do it our way, not a formal, boring conference or summit. Okay, are we game? This makes sense?